So bipolar type 2, the hypomanic episode. So it's like a very lower gradient of bipolar disorder type 1, and I'll explain why. So in bipolar type 1, it's kind of the extremes, mania and depression. And it fluctuates in between, or it could be mania with a little depressive episodes or no mania at all. Sometimes people have just straight mania. But in bipolar type 2, patients have history of depression and hypomanic episodes. It can be hard to diagnose hypomania because it doesn't seem too extreme. And I'll explain why. So essentially, it amounts to a psychiatric diagnosis for being exuberant and very productive happiness. However, patients with bipolar type 2 spend much of the non-hypomanic episodes in depression. So it's almost like they have depression with bouts of hypomania, which is a lower grade level of mania. So kind of the same acronym we discussed, the DIG FAST acronym. So distractibility, indiscretion, which is like impulsive behavior, guilty conscience, a flight of ideas, acting impulsively, talking fast, and rapid speech. So the criteria of a hypomanic episode is the same as criteria for a manicus episode, except the experience of expansiveness or irritability mood only lasts 4 days rather than a full week. And the episode is not severe enough to cause a marked impairment in social or occupational dysfunctioning. And so with hypomania, it's usually hypomania to describe definite high periods that have not caused real problems in life. When hypomanic periods alternate with depressive periods, the proper diagnosis is bipolar type 2, which is sometimes people, can misinterpret this as ADHD or mania or depressive episodes. So it's just important to recognize that these symptoms can fluctuate.